This thing doesn't stay.
It was nicely placed in my Board of Health.
Okay, good evening, everybody. And welcome to the McHenry County Board of Health meeting. We're going to do a call to order because we're live on audio, so Darlene will take a roll call.
Ms. Ortiz?
Yeah.
Ms. Carmen?
Here.
Dr. McGuire?
Here.
Ms. Altough?
Here.
Mr. Clark?
Here.
Mr. Markison?
Here.
Dr. Ansler?
Here.
Ms. Morawski?
Here.
Dr. Katz?
Here.
Ms. Gaffney?
Here. We don't have any public participation this evening, so do we have a motion to approve the January 9th, 2023 minutes?
So moved. Second.
Thank you. Any discussion, corrections? Darlene?
Mr. Clark?
Yes.
Ms. Altough?
Yes.
Ms. Morawski?
Yes.
Ms. Carmen?
Yes.
Mr. Markison?
Abstain.
Dr. Katz?
Yes.
Dr. Ansler?
Yes.
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Ms. Gaffney?
Yes. On to the April 8th, 2021 minutes. Do we have a motion to approve?
I'll make a motion to approve the minutes.
Thank you. Any discussion? Darlene?
Dr. Ansler?
Abstain.
Ms. Ortiz?
Abstain.
Mr. Clark?
Yes.
Dr. McGuire?
Abstain.
Ms. Morawski?
Yes.
Ms. Carmen?
Abstain.
Dr. Katz?
Abstain.
Mr. Markison?
I wasn't present, but I've reviewed the minutes and I'll vote yes.
Ms. Altough?
Following Mr. Markinson, the same.
Ms. Gaffney?
Yes. Before we get on to the department and division updates, I'd like to welcome Dr. Katz. Would you take a few minutes to introduce yourself to everyone?
Sure. I love talking in front of people on the spot. It's my forte. I'm Melissa. I'm a licensed clinical psychologist. I work in pediatrics, so I mostly see kids and adolescents. I'm our clinical director as well. So I'm responsible for just bringing in programming that makes sense with the needs that we're seeing in our county. I attended the presentation that shared that mental health and obesity and diabetes were the three largest health concerns that you found in the county, and thought it might be of interest to share a behavioral health perspective when necessary. So I have two small kids who gave me hand, foot, mouth last month, and that is why I was not here. So I thought I would share that with none of you. Thank you. You're welcome.
If you guys wouldn't mind just briefly introducing yourself around the table.
Hi, Laura Tomaso. I'm the medical advisor for the Board of Health. So I'm a immediate care doctor with Northwestern County.
Okay, great.
Joe Clark. I live out near Marengo. I'm a farmer.
Cool.
That's not all.
I know. People will all go to coffee one day.
We do. Right after this.
I'm Barb Amsler, physician, retired.
Pamela Altough, County Board Liaison.
And so much more.
I'm Cecilia, I live in Lake in the Hills, I'm a registered nurse.
I'm Juliana. I'm a registered nurse, retired.
Who can't speak very loud
I'm Kristen McGuire. I'm an emergency medicine physician, born and raised, and currently live in Crystal Lake.
I'm Kyle Markison. I'm also a board member. I live in Crystal Lake. I've been a firefighter paramedic for a little while.
My name is Mimi. I'm an administrative assistant for the health department.
And I'm Darlene. I'm also an administrative assistant with the health department.
Melissa Adamson.
Cindy Gaffney, a soon-to-be retired plastic sales rep, live in Marengo.
I know. Yeah.
Mary Ellen, you want to start with introduce yourself?
I'm Mary Ellen Howell. I'm with the Veterinary Public Health Division. I'm the director over there.
I'm Ann Marin, Director of Planning and Operations.
I'm Patty Noel, Director of Environmental.
Susan Pierce, Director of
There's a quiz, right?
Sure. Lindsay, do you
Lindsay, you want to go ahead?
Lindsay Sabatelli, the Community Information Coordinator.
Oh, you have a lot of emails from you.
Yeah, you
She's doing a great job.
Yeah, you'll get that question
No.
right.
Angelica Perez, works with the Communicable Disease Program Office Assistant.
This is admin administrative assistant to Susan Harris.
Nice to meet everyone.
Thank you, everyone. Melissa, would you like to begin with your department update?
Yeah, I just have
Oh, I'm sorry, excuse me, is Jay on the line?
I do not see him yet. We'll see him pop up.
Okay.
I have not. I did send him a text.
Oh, Lindsay.
Oh.
Go ahead.
Okay, so just a real quick update. We did hold 4 staff meetings in January to get the staff input on the ARPA funds. So we're currently compiling that information, and then we will bring it back to finance for further discussion, which was the direction. We hope to do that by next month. That is all I have until we. Oh, do you want me to do finance now or
Sure, might as well.
afterwards?
Might as well.
Okay, so pretty much we're on target at this point. There's only 2 months that we're reporting out on. So we're a little down on revenue. Again, that's often due to timing. So we should roughly be at about 17% of our budget at this point, both for revenue and expenses. So we're down in our revenue, but we're also down in our expenses. We're roughly 15% of our expenses. I don't think there's really anything unusual to report, but if anybody has any questions, I am happy to do my best to answer them.
Any questions? Thank you. We'll start at the way end over there, Susan. Director Karas.
So respiratory, the RSV, influenza, and COVID are still, remaining low. However, and it isn't really reflected because we have January numbers we're reporting in your packet, but we are starting to see an increase in acute gastrointestinal illnesses, as well as we're seeing a lot of strep. Start, presenting itself with the throat, scarlet fever, impetigo, those kind of things. So a lot of outbreaks that we're trying to manage at this time. We had our first pop-up naloxone education pop-up things at Woodstock train station, and we gave out 12 naloxone kits. It was one of those very cold days, so we were lucky to give out 12. So I applaud my staff for being at the train station there on that day. We also went to the People in Need at MCC on July 28th. It was very well attended, as it always is. There was over 710 attendees. We also presented we had a breakout session about food insecurity, and we partnered with the Northern Illinois Food Bank as well as United Way. And there's a little write-up and some pictures in your packet. We also expanded our VFC to the Crystal Lake location. We got a specific PIN number for that for the state to get our vaccine delivered straight to that location where before we were transporting it back and forth from Woodstock. So that should be a little bit more efficient for staff. We resumed our annual school nurse conference. That is a February event, but I'm going to mention it because it did. Lindsay came and covered that and did a nice write-up on Facebook. We resumed our Lena Rogers Award for the school nurses, as well as our Spirit of Public Health Award at that event. That's really all I have today.
Thank you. Any questions for Director Karas? Thank you. Director Noem?
So we wrapped up our recycling event for batteries that we do annually in the month of January. We actually had kind of an overwhelming response. We have batteries all over the place, all sorted, but we are waiting.
Non-touching, right?
Pardon?
Not touching each other.
Right, exactly. We've got it covered there. So, no, but we're waiting for some more battery buckets to get those, shipped and recycled. And last month I mentioned that we were going to be applying for an EPA outreach and education grant for recycling. And since then, we've actually joined a group with the Metropolitan Mayor's Caucus for a regional application for that same grant over a 3-year period of time. So it would be some local health departments several counties, and then some solid waste agencies. So we're excited about that because I think it could really be very impactful if we are able to get that. You should start to see some increases in the use of our lab. We are doing a pilot program with a local environmental company that does a lot of sampling that is struggling to find a lab that can do the sampling, so we are doing that in-house right now. And then if it works out well, then I'll bring forward a contract and adjustment for inserting those revenues in the budget. And then we will be getting up and running our drop-off program for water sampling that we've done in the past at townships. It's usually very popular, so we hope to get that up and going in the spring. And then we will be just getting ready to send out all our food permit renewal applications, which is really kind of a big process and goes on for a couple of months. So that's up and coming here in the next week or so.
Go ahead. What do you attribute the increase in the participation in the battery recycling program? Just awareness, word of mouth, what do you think?
Yes, I think it's all of those things, because we get some people that call us at the end of the year and say, are you gonna do it again? We have people that actually save them. We have people that bring them in that have kept them for really several years in the garage or, whatever. So I do think people are willing to do it, they're just looking for that outlet and that opportunity. But we have, I think last year we cycled around 2,000 pounds. We'll be at that much or more. So I do think that. So we're trying to do it annually, and it's working out well. I think people appreciate it.
Yeah, well, certainly, but I just wondered, participation increased a lot.
Yes, that's great.
I had a question for you. Someone asked me if there was a recycling for like plastic bottles and plastics. There's one for glass bottles in Algonquin Township there, off of 14, and cardboard, but it doesn't say anything about plastic. So do you know anyone in the county that does plastic?
Well, we just had a conversation about plastic. So, yes, plastics, all plastic is required to be picked up by any solid waste hauler. That's in our residential recycling ordinance, our municipal solid waste hauler licensing ordinance. They're required to take that plastic. So anyone that has a solid waste hauler that picks it up, they can put it out there and they will take all of it. The bigger question really is then the quality of that recycling and the market for it, and when it gets to that material, sorting facility, how much of that actually gets recycled. That's part of that outreach and that grant that we're trying to do as a region to try to educate residents about having higher quality recycling so that it actually does get back into that cycle and it's reused and usable materials.
And put in the right container so that if it goes in a garbage bag, it goes in a garbage bag.
Right, if it goes in the garbage bag, it's going to go into trash.
Which I know we talked about this, I don't think anyone is aware of that.
Well, they probably get a sticker from their solid waste hauler that says stop putting in a bag.
Really?
But that's all part of the thing that we're trying to do, is just give simple, straightforward recommendations that will really have a huge impact on the amount of those recyclables that actually make it back into the economic stream.
Yeah, because we had, just on the same line, that there's a feed kitchen in Madison that has a recycling content, they do recycling. But if you throw anything, one item in there, it contaminates the whole dumpster and it goes to the garbage. And people throw junk in there all the time. So
I think people think they're doing the right thing by recycling, but if they don't do it properly, Melissa and I just had this conversation, just because you think a drinking straw should be recyclable, Melissa didn't, I'm just saying, this is that conversation. Just because you think. I mean, you should have a drinking straw, does not mean dump it into the thing, because it will not be recycled. And then when it gets that machine clogged and things like that, that's what really causes a lot of problems. So those are some of the things that we have to make clear to our population.
thank you.
Yes.
On topic, if I recall correctly, a couple years ago, we had an issue with the solid waste handler where they were not, can you refresh my memory, we were not recycling correctly, or they were just dumping the loads? Do I remember that correctly, and have we had any other issues with that?
Well, no, we've done more monitoring of that. So we've been out actually to the transfer station, and we've watched them dump different loads of waste and make sure that it's been happening properly, et cetera. But it's just like Cindy said, it is always going to come down to, if they look at that when that's dumped on the sorting floor, if it looks like it's got a significant amount of trash in it, they're going to take that end loader and they're going to push it into the trash pile. They are not going to hand pick out the recyclable materials. So that's why we have to do better. But I think it's more from the end of where it's coming into, to the hauler, not so much the hauler themselves.
I think to maybe with Joe's, someone may have said this, but maybe some additional, advice or something to put out to people to get them on track, because I'll admit there's some times that I've heard things or read things like you hear about wish cycling, China's not taking it anymore, we don't recycle this, what's effective, what's not. Sometimes I'm at work and someone goes to throw a pizza box in, I'm like, you gonna do that, there's oil in there, it's contaminated, right? But there's different people with different opinions, or lack of knowledge, I think is what it is.
Right, I think you're right. I think people intend to do the right thing, but because they feel it should be recycled, doesn't mean it actually is. So it does take a little bit more work, it takes a little bit more sorting, it takes a little bit more cleaning of the containers. But we have done over the past 2 years, outreach, specifically to this with presentations and at Earth Day and all types of things. So I mean, we have that message out there, but we have to do better.
I don't think they take coated cardboard either, right? It's just, you can't.
No, typically it would be just the untreated,
Yeah.
regular.
So your pizza box,
A piece of rock has to go in your
Yeah, it's
compost.
trash. Or compost,
You can go in the compost bin, if you have curbside composting.
Any other questions for George? No? Thank you.
Thank you.
Oh, I just know, the EPA really likes collaborations for grants, so that gives us a one-up. That we're collaborating with other people, so.
And then it's a very large group.
Yeah, that's good, yeah, so. That's all Julie could say.
Director Merritt?
Thank you. So we had sent out a staff survey on professional development last month, so Deb Dorn and I have been collecting the information on several items that we asked employees what they would like to see for their professional development. And it ranged everything from Excel training, Word training, Outlook training, to expanding and strengthening your emotional intelligence, situational adaptability, conflict management and resolution, time management, core communications, the whole gamut. So we took all of those, kind of compiled a beginning program for professional development. This will be for all employees, frontline management, whoever wants to take them. This is being done through the COVID crisis grant. We still have monies through June. So we have scheduled 5 sessions so far with a group that we have worked with on leadership development, the Carol Keller group, and we are also calling MCC and partnering with them on additional professional development. So we will be meeting with them this week. Those are like active listening, time management, things such as that. So we will get those up. We're doing those through SharePoint, so employees can get on there and schedule accordingly as they feel they have time. Each are either 2-hour or 2.5-hour virtual classes, so they won't have to travel anywhere. It'll be much easier. Let's see, so these trainings will be taking place from March through June. We are also working with the county on an employee retention program. So we were all given books on state interviews, and we will be meeting with the whole county and county management as a whole next week to kind of review that and then begin our program of talking to employees and interviewing them. What they like about their job, what are you thinking about when you drive to work, what can we do to make you comfortable, and things such as that. Susan and I met with IT last week to review and update the HIPAA security policies. There are some changes and updates that we will be incorporating, and I'll be meeting with facilities next week to discuss some updates on the facility portion of the security policies. Taking us back to the OMA training. When we originally discussed it, we said everybody's got to take it yearly. So the AG's office had 2 conflicting paragraphs up there, and so we wound up calling the state's attorney's office, and they were kind of confused too, so they called down to Springfield at the PAC, who then said, well, we got to look into this. Called us back, and it is appointed and elected officials only have to take it 1 time. Staff is yearly. However, they did recommend that maybe you want to take a refresher. Because some of, I know some, I think you were 2014 or 15, I mean, we have some from a long time ago. There have been some changes and updates to OMA. So feel free, to take a refresher if you want to. The newly appointed board members, I will be sending out a link to the AG's office so that you can get on there and take that right away. I will copy the board too, and if you feel you want to take a refresher, feel free to do so. And you can get those certificates back to me or Deb Doran. Deb Doran and I will be doing a final review of the personnel policy handbook. We're holding off a little bit. We're looking to probably meet with the personnel committee to review next month and to go through all the updates and changes that we've incorporated. So that's all I have.
Quick question for you, on the Excel training, Word and that kind of thing, is that gonna be available just for people to just go online and train themselves?
No, that'll be, we're working internally with IT. They have a lot of programming they want to do for employees. Excel being pretty much the #1 thing that everybody, whether it's beginner or advanced and intermediate, everybody kind of responded to that. So IT will bring in somebody and we can do separate classes. They did it last year. And we're going to work with them to continue doing that so that we can have some of our frontline, staff seem to be very interested in this one. So.
Any questions for Director Mary? Director Howell?
Okay, so we just have a couple updates for you. Our volunteer numbers are going up. I know January still looked about the same as last year, but we have a few new programs that are coming on. We have some groups that are transition services. So that's people, adults who are coming out of high school, trying to go into the independent living, and they're coming into us to learn just some skills. So we've had that in the past, and we're happy to have them back. So we're doing every other week. I'm happy to say that, I would, even though I don't know if this is would, we have one position left open, one animal control officer. We have 2 employees starting in March. We have 2 employees start end of January and February. So we're very happy to see everybody start moving through that process. We're going to hold off on the last one because obviously if you're training for animal control officers, that's a lot of time on the supervisors. So we want to kind of break that out a little bit. Now that said, an animal control officer now works in the kitchen, works in the kennel, the kitchen. Well, they might be doing dishes in the kitchen too. They work in the kennel, they work in the office, and they work in the field. So they're having time doing all of those things and learning everything from dishes to laundry. So, ALDF, that's the Animal Legal Defense Fund that we got the grant for. We put through about 75 different cases with them. We only have about 4 or 5 that are not resolved. Most of them are found either unfounded or resolved one way or another, whether it be something as simple as a grooming, an animal that has a lot of mats that needs to be groomed, or an animal where maybe the individual has some financial issues, gotten to the point where they really need to take care of that animal, but they can't afford the blood work. We're able to actually provide a little bit of service there through the grant to help them pay for that. We don't pay for it completely, but we do assist with that process. So that's been a real benefit of that program. Let's see. With that program also, we have purchased about $4,000 in equipment, from anything from necropsies to any type of equipment they need in the field to do those investigations. So we had some of that equipment, we wanted to beef it up a little bit. And then finally, just a reminder to you, Melissa was talking a little bit about finances. We do typically hold, again, about $24,000 to $28,000 in payables each month. So that is vets who send us their tag packets, that's their registration packets, and then we bill them, and then they pay us. Many of those are because a third party is paying us, so the invoice has to go to the vet's office. They have to approve it, send it on to the third party, and then we're paid. But typically every month is somewhere about $24,000. That's my list.
Thank you. Any questions for Director Howell? Dr. Angela?
I think last month you talked about an influenza outbreak in dogs.
Bring that up. I did have it on my list, but I was like, oh, I'll skip that one. We haven't had any more calls for that. Now, it could be that there could be 1 or 2 out there. It's not reportable. They don't have to let us know. We've sent an email to all the vet's office to ask them to let us know. But it is also an expensive test. So they may be just treating some animals who have something like the flu, but not the canine. So we haven't had any more calls. So thank you.
I noticed that the tickets issued for this January compared to last are over double, but the cruelty investigations are down, but the tickets are up, and I was just curious if you could articulate what.
Those would probably be violations. So one of the things that happened was, we send out the postmaster, we send out the online violation to people through their emails, and really, people are sort of catching up. So vets are catching up, we're catching up, and even though you see those tickets written, it doesn't mean that they are all paid. Some of them, it's just a matter of them sending us their documentation, and then we void the ticket.
So those are for not having tags or
It could
registration?
be vaccination, it could be registration, it could be an animal running at large.
Okay.
There are a variety of things that could be written for.
I just looked through there quickly and didn't see one, any rabies, any issue rabies this month or anything, issues with that?
We have many positives.
Great, thank you.
Any other questions for Director Hall? All right, thank you all. On to the consent agenda. Do we have a motion to approve the consent agenda?
So moved.
A second?
I'll second.
Do we have anything that anyone wants to pull out for discussion? Darlene?
Dr. Katz?
Yes.
Dr. Ansler?
They happen to all of us.
Yes.
Mr. Clark?
Yes.
Ms. Ortiz?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
Ms. Altough?
Yes.
Dr. McGuire?
Yes.
Ms. Borowski?
Yes.
Ms. Gaffney?
Yes. Contracts and agreements, we've got the Illinois Department of Health Care and Family Services, the SNAP.
Yeah, this is a new contract that we do for Department of Health Care and Family Services. We already do presumptive qualification for public aid. They reached out to us to help apply, individuals to apply for the SNAP benefits. So we will be conducting that as well.
Any questions on that?
I'll make a motion to approve the Illinois Department of Health Care and Family Services SNAP contract.
I'll second.
Any further discussion?
Who was the second?
Me.
She said it so quietly, you just couldn't hear me.
Yeah, I'm sorry.
Darlene?
Mr. Markison?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Dr. Katz?
Yes.
Ms. Altough?
Yes.
Mr. Clark?
Yes.
Dr. Ansler?
Yes.
Ms. Carmen?
Yes.
Ms. Borowski?
Yes.
Ms. Gaffney?
Yes. On to the Illinois Department of Health Care and Family Services, HIPAA.
This is just the agreement that goes with both those contracts, MPD and the SNAP, because we will be handling HIPAA information. We're required to have that addendum or contract with those contracts that will be maintaining that compliance.
Do we have a motion to approve?
Make a motion to approve the Illinois Department of Health Care and Family Services HIPAA.
Thank you.
Second.
Thank you, Dr. Nichols. Any further discussion? Darlene?
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
Mr. Markison?
Yes.
Ms. Altough?
Yes.
Dr. McGuire?
Yes.
Ms. Borowski?
Yes.
Dr. Ansler?
Yes.
Ms. Gaffney?
Yes. Program highlights were addressed in Director Maron's report out, so we won't have anything on that section tonight. On to new and unfinished business. 9A, resolution adopting the title changes to existing McHenry County Department of Health positions within the Division of Environmental Health.
Madam President, the Personnel Committee met last Monday night. We reviewed the proposal presented to us by Ms. Adamson. By unanimous vote of the Personnel Committee, we recommend that the board adopt this resolution. And so I so move.
Thank you. Do we have a second?
Second.
Any further discussions or questions? Darlene?
Ms. Carmen?
Yes.
Dr. Ansler?
Yes.
Ms. Altough?
Yes.
Mr. Markison?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Ms. Borowski?
Yes.
Dr. Katz?
Yes.
Mr. Clark?
Yes.
Ms. Gaffney?
Yes. The 9B, resolution authorizing compensation for bilingual skills in the McHenry County Department of Health fiscal year 2023 budget.
Madam President. Both finance committees and personnel committees have reviewed this and has come under great scrutiny from staff, personnel committees multiple times, and both committees unanimously recommended this for approval. And as such, I would like to motion to approve the resolution authorizing compensation for bilingual skills in the McHenry County Department of Health's fiscal year 2023 budget.
Thank you. Did a second?
I'll second that.
Discussion, for those of you who don't know, do you want to just bring everybody up to speed on what the bullet points were that you covered? So implementation,
Yep. So in general, there's a lot of nuts and bolts, but in general, this was an idea brought forward ostensibly initially by staff, and then Director Karras, I really think, spearheaded this. Administrator Adamson put a lot of work into this. It's obviously been reviewed by all the divisional directors, and we've had multiple meetings on this. So finance has had this twice, personnel's had this once. There's been a lot of conversation about, again, those nuts and bolts. So we have reviewed and revised both the initial offering. The idea in general, if you're not familiar, it's the idea that staff who have bilingual ability, and at this point we're really, the focus is on Spanish because that's our greatest need, will be able to test for 2 different levels of proficiency that will then afford them 2 different levels of compensation. We can go into specifics on that. There's also, for those people who are bilingual and not in Spanish, there's also an opportunity there for them to receive a per diem when that need is encountered. In addition to that, there were conversations obviously about the implementation, who is able to test for this, how is it tested, the proficiency is going to be conducted by an outside company, and then the resolution was put forth, a general sense of how much this will cost. Does anybody need more specifics, or is everybody familiar with this?
any other questions on this? I want to thank you, both the finance and the personnel committee, because there's a lot of passion behind this, and we wanted to do it right, and I appreciate the work that went into it. Thank you. Any further discussion? Darlene?
Ms. Carmen?
Yes.
Ms. Morowski?
Yes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Dr. Ensler?
Yes.
Mr. Markison?
Yes.
Dr. McGuire?
Yes.
Mr. Clark?
Yes.
Ms. Altough?
Yes.
Ms. Gaffney?
Yes. Bilingual pay policy draft? Is that incorporated in what we just?
We did list them
kind of
under them
assumed it was
because
part
it
of it.
was sort of dependent on the first piece.
Okay.
We wouldn't move forward without approval.
So this is the pay policy that spells out within the department how it will be implemented. We've also reviewed that. Would you like a second motion?
Do we?
Yeah, I think because
Yeah.
it's gonna go,
Okay.
get incorporated into the personnel policy, we
Yeah.
wanted a separate motion, please.
Madam President, I'll make a motion to approve the bilingual pay policy.
Thank you.
And I will second.
Thank you. Any further discussion? Darlene?
Ms. Altough?
Yes.
Dr. Ansler?
Yes.
Mr. Markison?
Yes.
Ms. Morowski?
Yes.
Mr. Clark?
Yes.
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes. B2 is the Alta language testing agreement, which is obviously for what you discussed earlier, but we need to make a motion to approve that as well.
Madam President, I'll make a motion to approve the Alta language testing agreement.
I'll second.
Thank you. Any discussion?
I just have a question. I was trying to figure out the total fee. Do we do all 3 testings to somebody, or is there a higher level and you don't have to do? I noticed there were. No, I'm done. You got me.
Is the question like, are we going to test everybody for interpretation, translation?
Exactly. Or is there like a
So
higher?
there's sort of people, so we've identified staff already who we know are bilingual, right? who will definitely be tested for interpretation. There are fewer people that we have identified who may be interested in testing for the translation. And then if it's another language, right, other than Spanish, they would be tested for that, for what Kyle was referring to before. It's actually a per minute cost based on the language. Like, I'm not sure, is that your question?
It is, so is there an estimation of overall how much this is gonna cost?
For the testing piece, it's just under $2,000 based on the initial number of staff that we had identified. I think it's 1925, if I'm not mistaken. So that's not listed anywhere, that's just on a spreadsheet identifying the people that we think would test. In both in translation and.
Just curious, thank you.
Any other questions on that?
Good question.
Darlene?
Ms. Ortiz?
Yes.
Dr. Ansler?
Yes.
Ms. Morosky?
Yes.
Dr. McGuire?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
Ms. Altough?
Yes.
Dr. Katz?
Yes.
Ms. Kaplan?
Yes. Do we have any other board issues for this evening? Do we have any need to go into executive session? Do we have a motion to adjourn?
So moved.
I'll second that.
Second? All in favor?
Aye.
Aye,
Thank you, everyone. Have a nice evening.
thanks.
Unless you want to stay.
And then it's on there.
It's a good one. 7:17?
Yeah, last month was.